Today I'm speaking to Dave White, Global Director of Sales and Marketing at medical security and travel assistance service provider Helix International. Helix won the inaugural Relocate Award for Global Health and Wellness in 2013-14 for its international medical screening service, which enables employers to assess the health risks facing their global workers and relocating dependents, and to ensure they are suitably prepared before undertaking an assignment abroad. Dave has a wealth of experience of working with global organisations, relocating staff abroad and providing them with medical and security assistance, international occupation health services, etc. Dave has a wealth of experience of working with global organisations, relocating staff abroad and providing them with medical and security assistance and international occupational health services. First, let's talk about the Global Health and Wellness Award. This was the first year of this new category. So why did Helix decide to enter, and what were the benefits of winning?
Look, on the medical screening side that Helix International is responsible for, we challenged the marketplace over 3.5 years ago. We looked at the industry, how it was actually being done as pre-deployment medicals, and we looked and worked out there is a better way of doing this. So our understanding was to educate the market and then finally put a solution in place for our clients that they really did not only need but actually now appreciate, and it's gone successfully very well for us.
So why is it important for HR to understand about health and wellness and healthcare issues, and what do they need to know in managing a global team or an international assignment?
It's amazing how many times we screen populations, and when there's a material issue in there and HR gets involved into that process after consent is signed off, how the company was unaware of either the employee or their dependents' illnesses. Now, why would they be? But the reality of them now going overseas to a foreign post is going to have significant bearing on them. To an extent, we've seen treatment paths in foreign countries that can be into hundreds of thousands of dollars, whereas if they just turned up and not gone through a screening process, the company's backpedaling already. So by HR understanding what the risks are, preparing their people before they go overseas, but more importantly, identifying issues. It might be getting prescription medications in China. It might be getting treatment paths out of Shanghai that aren't available, so they've got to go down to Hong Kong. But the reality of the matter is that those problems will come back and bite global mobility, international HR, they have to deal with it. And really, as I said at the start, because they were preventable and predictable, that's actually just unnecessary, and it's actually poor risk management practice.
And that's also for the employee as well and their families?
Absolutely. There's the other side here. We're talking talent management. If we're going to send our people overseas for 2 to 3 years on behalf of our organisations, we want to be looking after them, and we want to look after them so they're going to be healthy, they're going to be safe, be able to continue their assignment and finish the job that we sent them out there to do in the first place. But how well informed are they going to be about those risks? I think they'll feel a little bit better as employees that the corporation's actually looking after them in perhaps the more emotional touch side of it. So critical, but at the same time, what's this about? It's good business continuity. It's planning for foreseeable risks, so it addresses your duty of care. But also, for the worst case scenario, it protects your brand and certainly your intellectual property that you are sending overseas. And to do that at the very start around their medical health, that's just sound risk practice.